Well, let's kind of switch hats, and that's the nature of healthcare consumerism. We've got a lot of different moving parts, and all of it, points towards creating a successful program. And really, a deep and ongoing discussion right now is about wellness and total well-being. And joining us to lead that discussion on this segment is Emily Noll, National Director of CBIZ Wellbeing Solutions. Emily, good morning to you.
Good morning. Thanks for inviting me.
Yeah, nice to have you on this program. You coming to us from up Maryland way?
Yep, out in Columbia, Maryland.
Is it getting to be holiday weather up in Columbia, Maryland?
It's finally dropping in temperature, so no snow yet.
I think we all had it warm for a while. Emily, I think we've had a series of CBIZ executives on this program. It's great to have you here. Give our audience a background specifically on your practice, the Wellbeing Solutions practice, and what you guys are doing at CBIZ.
Yeah, sure. We're doing some exciting work. We've been working with clients in the well-being and wellness space for a few dozen years now, but we're kind of really ramping up our efforts to help our employers develop their strategy and take their wellness programs to the next step so that they can get some good outcomes.
Yeah, give our audience a definition of wellness and well-being. What is the differentiator around well-being from what is maybe looked at as traditional wellness?
Well, well-being is certainly the buzzword today, and I'm hopeful that it's here to stay, for good reasons. Traditionally, employer wellness programs have focused on physical health, so that includes things like promoting and improving access to preventative care screenings, exercise, nutrition, and tobacco cessation resources. And the goal really is, an effort to keep healthy people healthy, but also prevent chronic conditions. And those have since evolved to address stress and depression, as well as disease management programs, such as, helping employees manage conditions like asthma and heart disease. But today, more and more employers are using the term well-being to really shift their strategy to a more holistic approach and really get at the range of risks that are driving a range of costs employers are facing today. So when we talk about well-being, we're thinking of it in the context of the way an employee feels, functions, and judges life. And that's pretty different, of course, than focusing on employees' cholesterol, for example. So the higher the employee's well-being, the more likely they are to function positively. But also, employees with strong overall well-being are less likely to be sick and absent from work. And when employees do face a serious health issue, if they have high well-being, they're more likely to deal with pain better and recover more quickly.
I think Emily makes a ton of sense. Taking just one of the pieces, financial wellness. It just makes all the sense in the world that needs to be focused on because, to go tell somebody to run 3 miles a day if they're struggling to pay their mortgage and pay their bills is a pretty heavy lift when they're going to go maybe across the road and eat biscuits and comfort food, because they're just stressed out. So unless we help address that part of total well-being, and it's only one part, we can't have really, total wellness, of an individual.
Yeah, absolutely. That's a really good example. And we have lots of evidence that financial stress has a huge impact on employees as well as other components of well-being.
I know CBIZ, you work with all different sizes of employers. So how are the mid to large employers embracing and finding value in making the move to total well-being? What do you see out there? And does it differ? It obviously probably differs by sectors, but what are you seeing with your clients? It's
been really valuable on several fronts. Studies are showing that a positive relationship exists between well-being and health. Employee well-being is proving to be an even stronger predictor of health and performance than behavioral and physical health risks, demographics, and even healthcare utilization alone. So taken all together, an employer can really get a powerful picture of what's driving their costs and then be better able to make decisions about how to address it. That may be through their plan design, their networks, their menu of benefits, and just overall improvements to the organizational culture. So, through a well-being lens, mid-sized and large employers can really identify what the risks are and offer benefits and interventions to address a wider range of needs and priorities. And then where an employer may have narrowly addressed risk in previous years and consequently saw lower return on their investment, now employers have the ability to address a range of factors and really maximize the value that they get out of these types of programs. And then I would say
Emily,
even for the small groups, they are, moving to well-being. It also reinforces the importance of creating a workplace environment and culture that helps sustain these healthy habits and underscores the impact of our social relationships at work, such as with our manager, that impact on health and engagement.
Emily, it's Ron Bachman here. I love what you're doing here in terms of connecting some dots and expanding and evolving, if you will. Wellness to the well-being affects health and relating it to productivity and to the bottom line, if you will, of companies. I think that's ultimately a much more all-inclusive model, if you will, than just looking at, well, what's my cost of health care? It's how does it affect the whole individual and how does that individual affect the organization? Is that the big differentiator in what you're doing versus what a lot of other companies are doing in this wellness space, or are there some other areas you'd like to share with our audience that makes you so unique?
Yeah, I think, Ron, what we're doing is helping employers, take a proactive approach to this. Really, in advancing their population health management strategies, we're finding it helpful to use the terminology of well-being with employers and talk about the 5 key elements that drive a person's well-being. Traditionally those are, purpose or career, relationship health, community well-being, financial security, and of course physical health, which we've been addressing for a while. But we're able to then talk with them about how they can make a difference in these areas, and whether it be through surveys or other data, they can get a better idea of where their employees have strengths and then what areas are important to prioritize for improvement. So that enables us to really, I think, one of the differentiators is using that type of terminology and programming to really build an engagement strategy that's going to be effective and make a big difference in the results.
Well, you start off by saying wellness has been around for a while. You hope wellness and well-being, stays the focus that it's been. We here at IHC firmly believe in that, and in fact, in the conference that's coming up in Atlanta in May, we are working closely with the Atlanta Wellness Professional Group. We will probably have wellness expertise from the 40 largest companies here in Atlanta to really emphasize the point of your services and your products and how companies are implementing those ideas. We'll have, a lot of people may not know, but Atlanta is the home base of a lot of big brands, whether it's Coca-Cola, Delta Airlines, Home Depot, Chick-fil-A, a number of other big companies are all going to be UPS, yeah. Those companies will have representatives at our May meeting talking about wellness on various stages, whether it's a general session or in some workshops. So we firmly believe that you're in the right space and doing the right things and meeting a need out there that employers are really looking for and evolving around.
And Emily, one of the continued challenges in wellness and total well-being space is, presenting the ROI and gaining an ROI understanding with the C-level execs, that CFO, that CEO, that some of this stuff doesn't happen overnight. It takes a year or 2 years. How are you helping your clients tell that story and show the type of metrics to that C-level executives that they really can buy into and understand why they need to be doing this?
Yeah, and I expect, Ron and Doug, that to be a big topic of discussion at your conference as well.
Yeah,
because
employers
are definitely struggling in that area to show a return on investment, particularly with the traditional wellness programs. We've had a lot of success stories, and I think the good news is that we have mounting evidence that the strategic shift to well-being is producing positive results fairly quickly. Again, that's not overnight, of course, as you say, but I think, we can adapt and modify the programs that we're offering to be more holistic, to have a bigger impact. So, for an example, in a study of employees with and without diabetes, we learned that well-being is a more important determinant of productivity than the presence of diabetes itself. So if we're treating the person holistically and not just the physical aspects of the disease, we can get better results. And that goes the same for employees experiencing anxiety and insomnia. If we're able to identify that financial stress is a major contributing factor to that, we can provide more effective solutions.
I'm going to make an assumption here, but is there a positive assumption that can be made that a C-level executive can really grasp maybe a little bit better this total well-being, story and relate to that about financial wellness, about emotional health, et cetera, then maybe they've been able to get their arms around making their whole population well. I mean, there's a common sense, business sense, approach to well-being when you sit back and look at it. Is that a fair assumption to make?
Yeah, there's a common sense approach about it, and I think fundamentally they believe that happier and healthier employees are more productive and more creative and contribute to their business growth. So I think, as an industry, we're working on moving beyond that, general kind of feeling of, yeah, I get this, to what kind of metrics can we look at to help tell our story and show that it's having an impact.
Yeah, help us look ahead to 2016 and beyond. What do you see in this space in 2016 and beyond? What do you see happening, and what kind of initiatives are you behind that may be changing in the year ahead?
Yeah, I think some really exciting things happening, and definitely some employers innovating in this space. I think in the past year we've seen a lot of focus on compliance-related issues and wellness regulations, as well as incentives. And I think this coming year, as employers are approaching wellness efforts with more experience and better data, they will be able to make more significant progress in really building a culture of health. And so I think one of the top trends for employers will be to create and document a long-term well-being and engagement strategy. There's still about half of employers who don't have a written plan in place. So they really need to understand what they're addressing, have a goal that aligns with their business goals, and then put a written plan and strategy in place to guide those efforts. And then other trends I see happening are really, as we've been talking about, expanding the scope of the programs to address financial and other well-being priorities, looking at how we can empower employees and managers to take healthy actions, and enhancing those cultural and environmental supports, that we can do through the workplace to help make, the healthy choices the easy choices and help sustain behavior. And then finally, I think, one of the really neat emerging trends is being able to leverage all the new health technology, well-being apps and activity devices. We'll see a lot more of that, a lot more penetration in the market of activity devices and those types of technologies.
And you see gamification playing a key role here too. Is that fair to say?
Yeah, absolutely. I love that employers are expanding the use of technology and gamification to really draw in all generations of workers, and through games and on portals and activity devices like the Garmins and so forth, and Facebook-like portals where people can really connect with each other, cheer each other on, and share their success stories.
That's great, Emily. Listen, really enjoyed having you on this program, and we look to get you involved with us maybe in some of our future event programs. I think you would bring a lot of expertise and into our program, so look forward to talking to you about that. I'd like to give you an opportunity to kind of wrap this and leave our audience with a few takeaways, if you would, please. Yeah,
sure. And I appreciate you having me on. I can talk about well-being all day. But employers are really making that move, I think, from focusing on employee wellness to well-being, and I think that's exciting. And that holistic view of well-being beyond physical health will really give employers a more significant way to impact the results. I also think that some of the trends that are going to happen in 2016 will make a difference in how we engage employees. So while we not only want to engage them in programming, we want to engage them in actually changing and sustaining behavior. So the use of gamification and those types of use of technology is really going to make an impact. So we have a long way to go, but I think we can make a big difference, and we'll be doing that this year.
That's great, Emily. Let our audience know if they're listening to this either live right now or on the podcast, how they can get in contact with you about some of the information you've been discussing.
Yeah, absolutely. We have. You can always reach me through my email, enoll@cbiz.com. We also have on our cbiz.com website a well-being section where people can learn more about, the steps of an effective wellness program and sign up for things like our monthly Wellbeing Insights newsletter, which has been a really popular resource. So lots of ways to contact and be happy to help in any way.
Great. Emily, thank you so much. Listen, have a very happy holiday and a great new year, and we look forward to talking again the first of the year.
Sounds great. Thanks very much.
Take care.